Good afternoon, everyone. Thanks for joining us. Sorry to keep you waiting. April is National Volunteer Month, and we want to thank all of the wonderful volunteers in and around Dutchess County, those who contribute to Dutchess County government, but also every one of you who volunteer in some way throughout our community, whether it's with a Girl Scout or Boy Scout troop or Little League or soccer clubs or perhaps your church or some charitable or service organization of interest and value to you, some faith-based organization. We're thankful for your service. We want to recognize, of course, our Medical Reserve Corps volunteers. Hundreds of them have stepped up over these last 14 months to do amazing things like organize testing, respond on our hotline, and deliver food and meals to residents throughout the county, along with their dedicated and real selfless work at our vaccine points of distribution. They've been doing tremendous work at our clinics, and we're tremendously grateful to them. In fact, yesterday, helping to administer 1,100 doses at the JCPenney's location in Poughkeepsie. This is also National Public Safety Telecommunications Week. What does that mean? Our emergency dispatchers, whether they work for a local police or fire or rescue agency doing dispatch, or of course in this county our own 911 dispatchers, we're tremendously grateful to them too. They're the thin gold line that helps to respond to emergencies, and of course they do tremendous work, and we're very, very grateful. They came to work every day, all day, these last 14 months, and certainly before, and will continue after, and they just do tremendous work, and we're very, very grateful to them. Let's jump directly to some of our data points, and as we do that, if you have a question, write it in the comment section below the live feed. Happy to get to as many as we can today. The County Health Department is monitoring 1,144 active cases, 1,104 active cases of COVID-19 throughout the county, with 63 individuals hospitalized and 432, sadly, have lost their lives to the virus. That's actually very heartbreaking. 6 additional deaths since the last time we got together. The county's positivity rate is 4.28%, and it's been very stubborn. I've used that word before. We just have been stuck at about 4%. We ticked up to a little bit over 5%. We were down for a period of time actually below 3%, but we've been stuck at this 4% for 4.5% for several weeks now. It is important to remember, and I've said this many times in these last 14 months, the positivity rate is not a perfect measurement. It is merely the number of positive cases, in essence, the number of positive tests that we are made aware of today, divided by the total number of tests conducted today. So you could have the same number of positive cases every day, but if the test numbers fluctuate as they have, lower or higher, positivity rate goes up or down. You can have a fluctuation in positive cases, but the total test numbers may grow or decline with that number as well. That affects the math and also affects the positivity rate, which is why we look at that 7-day rolling average, which is important. But again, it is simply a measurement tool that we use, that everyone uses, and it is simply based on the number of positive tests that happen to come in on a day divided by the number of tests conducted on that day. And as you likely know, we don't get positive tests or any test results with any uniformity, right? You can go to one lab, get that back in 48 hours. You can go to another lab and get that back in 3 to 7 days. So we use this as a measurement tool. It's not to diminish the value of the positivity rate, but it's to explain it. It is an imperfect measurement that we just use as information, and we've been stuck at this 4.28%. We've seen some fluctuation in testing. If I'm correct, April to date, today we saw 1,368 tests conducted. Does that sound right? With 61 positive cases. Do the math. That 61 divided by 1,368. But as a reference, March, 1 month ago, we administered 3,000 tests on March the 12th with 121 positive cases. So again, you can see that the fluctuation. However, we look at that 7-day rolling average, 4.28%. is still a little bit stubborn, and it does seem that basically from Dutchess County to the tip of Long Island has been this range where the positivity rate has just been sort of plateaued in this particular area, and it's something obviously we want to be sensitive to. We want to be able to encourage. We want to continue to encourage you to follow those mitigation steps we've all talked about. Be safe, monitor your own health, wear a mask, social distance. And of course, monitor your own health and use appropriate personal hygiene. I apologize. This is my Apple Watch. I just have to. It rings on me, and then it becomes very confusing. So I have to turn it off. Otherwise, I get distracted. Somebody told me I was looking at my watch the other day, and it was bad. Let's talk a little bit about vaccine distribution. We are now at nearly 42%. So 42% of Dutchess County's entire population has received at least their first dose of a vaccine. That is 123,129 residents have received at least their first dose, 41.9%, 42% of Dutchess County's residents receiving their first dose. Keep in mind that not every resident is eligible for the vaccine. About 20 to 25% of our population is 16 years of age or younger, aren't eligible. And so when you look at that number, I would guess, if I'm doing my math correctly, of those who are eligible, we're much closer to 50%, probably about 50%, maybe a little higher. But nevertheless, for those who are, for the entire population, we're at 42% have received their first dose, with now 26% having completed their series, 75,000 residents completing their entire series of vaccination, and that's important to note. Now, I will say this, the county health department itself, so through those clinics and through our partners, the Dutchess County Health Department in Dutchess County has administered 41,366 doses in the community. We often get asked, how many doses has Dutchess County given out? Residents have had to leave the county. Some have left other counties to come here based on accessibility. What have been the numbers in county? Well, 41,366 doses have been administered within the county by the county health department. There are thousands more administered by the hospitals, by the pharmacies and others, but nevertheless, 41,366 doses administered in and by the Dutchess County Health Department. So very important to know. Now, we're joined today by Dr. Adenovector. Dr. Wythian is our Commissioner of Health. I want to get to him in a moment and talk a little bit about, and you may have questions regarding the J&J vaccine. So let me start by first saying that Dutchess County adheres to the FDA guidance, which was supported by the New York State Department of Health. The FDA has asked for a pause in the administration of the Johnson & Johnson single-dose vaccine. This is as a result of 6 United States residents, citizens, and 6 cases involving blood clots among individuals who have also received the Johnson & Johnson vaccine. I'll have Dr. Wythian talk a little bit about that in a moment, but you should know that 6.85 million Johnson & Johnson doses have been administered throughout the country, and Dutchess County is following the same guidance that was issued by the CDC, FDA, and New York State Department of Health, and have paused our distribution and use of the Johnson & Johnson dose as the FDA conducts its analysis. I want to extend our appreciation to the FDA. I think Dr. Wythian would confirm the FDA is known as being a bit more conservative in their analysis and approval of drugs and vaccines. In that said, they have taken this action out of an abundance of caution to evaluate whether or not there was some connectivity and what action should be taken to continue to provide for public safety. Dr. Wythian, we're going to jump to you now. I think I've explained it basically. Do you want to explain what residents should know about what the FDA has done and what we should know about the Johnson & Johnson vaccine?
Sure. Thank you for having me today. As Mark had mentioned, the FDA, and in coordination with the CDC, has put a pause on the administration of the Janssen COVID vaccine. What should be recognized is that the blood clots that were reported is a complex and a serious or special type of blood clots. It was occurring in the brain, and so interestingly, the Johnson & Johnson or the Janssen vaccine, it's what's called an Adenovector vaccine, and it's similar in that it's an Adenovector vaccine to the AstraZeneca vaccine that uses chimpanzee adenovirus as the vector for their COVID vaccine. And the AstraZeneca vaccine that has been distributed in the UK as well as the EU has been associated with thrombosis, which is blood clots, in multiple areas of the body as well as the brain. And so given the fact that post-authorization monitoring, that's usually through VAERS or through direct reports to Janssen itself, the FDA and the CDC identified 6 individuals with this special and different type of blood clot. And so out of the abundance of caution, they put a pause. Another purpose of the pause is to make providers, medical providers, aware of not only the situation, but also to the fact that the blood clots that's associated with the vaccine behaves differently than other blood clots, and so it's treated differently. So if you treat blood clots with the typical blood thinners, which is heparin and warfarin, that may actually make matters worse. So that's one of the intent of the FDA, to notify physicians on the clinical presentation and what to look for. The other purpose was to notify the general public that if they are indeed having certain symptoms, meaning if you have received the Janssen vaccine and if you develop symptoms within the next 3 weeks of headaches, swelling of the lower extremities, abdominal pain, shortness of breath, all these signs and symptoms may be suggestive of the presence of a clot, and they want you to seek medical attention right away.
Thank you, Dr. Wythian. Can you offer, currently, we are aware, and the FDA has reported awareness of 6 individuals who have developed this rare blood clot. They are all women. They are men and women. What do we know about those 6 cases? Nope. I think we've lost you, Dr. V. You have to.
Can you hear?
I can hear you now. Go ahead.
Okay, it's the mute button. Indeed, there were 6 individuals that were identified post-authorization. During the clinical trials, there were 2 individuals with this type of clot. And one of those individuals was male, but all 6 cases identified post-authorization by the FDA were females.
Okay. And so is this the ordinary course of action for the FDA? And assuming that there is, and again, I don't want to assume, let's say there is no further area of alarm, what might the FDA do as it relates to the Johnson & Johnson dose? Will they issue just an additional piece of advice if you're particular age, et cetera, you might want to consider medical attention or talking to your physician? Is this an ordinary course of action for the FDA, and what might be the logical conclusion of the FDA? And you can say you don't want to answer that, but I wonder what they might do.
Sure. So this should reassure individuals that the FDA and the CDC holds vaccine safety as a very important priority. And so the fact that they identified these cases and thought clinically they were related to the thrombotic events associated with the AstraZeneca vaccine, it's reasonable that they did this. also to bring attention, as I said before, to the medical community as well as the community at large, the 7.2 million individuals who've been vaccinated with Janssen, that indeed this complication does exist. So just to put things in perspective, we're talking about 6 events, and the denominator really is 7.2 million people who have received it. So we're talking about one, occurrence in 1 million doses given. So it's an extremely rare occurrence, but the FDA and the CDC felt that out of an abundance of caution that they needed to do this to review the literature, review the data, and they are meeting as we speak. The ACIP is meeting as we speak to review the data and discuss further recommendations. So some of the possible endpoints in terms of continuing the pause or resuming or making further recommendations in terms of age groups that may be recommended to get the Janssen products, all of that are possibilities.
Okay, and the ACIP is what?
The Advisory Committee for Immunization Practice. I'm sorry.
That's okay. We all have our alphabet, and we want to make sure folks know what it is. And you mentioned this. Healthcare providers are asked to report any adverse event through the VAERS system, right? This is the Vaccine
Correct.
Adverse
Right.
Event Reporting System. And a medical provider would have access to that link and would advise the Department of Health and Human Services of any particular adverse event that could be added to the body of study, right, for the FDA.
That is absolutely correct. In fact, the health department, even for things that we don't believe are related, but temporarily were related to the vaccination, the health department have made multiple reports, VAERS reports. And so physicians have the ability to report directly through VAERS or report directly to Janssen. And so the usual practice is to report through VAERS.
Terrific. And if you are experiencing any of those particular symptoms, you as an individual should reach out to your healthcare provider. If one doesn't have a healthcare provider but got the vaccine through us or a pharmacy, they should contact who, Dr. V? Can they reach out to our health department, or can they? Not that we want to encourage that in a frivolous sense, but if there's someone they need to report any particular concern to, but don't have a healthcare provider, who do they do that to?
So if there are questions or concerns, obviously, the call center and the health department can answer some of those questions. If an individual is experiencing the symptoms that I mentioned and it's a medical issue, they should seek medical attention right away.
Okay.
Meaning, go to the emergency room, go to the hospital to get evaluated.
And so we had a question come in as you were speaking, which I think is a good one and likely something people were thinking. Does an individual have to be concerned about this same blood clotting with having received the Moderna or the Pfizer doses?
At this point, there is no association or linkage.
Okay. And we think it's because, just like, and you said this early on in your answer, but this is a similar vaccine vehicle, if you will, to the AstraZeneca vaccine, and that it is that particular design, if you will, that mode that they're looking into. I don't want to say concerned or not concerned. They're looking into any particular linkage because of the mode that this vaccine takes to provide you the benefit.
Yeah, they're looking at this particular clinical presentation with this vaccine. They have some suspicion on the clinical mechanism. So just to, without complicating things, individuals who presented with these complex thrombotic events or clotting events, what they presented with is not only the clot, but low platelets as well as antibodies to something called platelet factor 4. We won't go into it, but again, this complex of presentation and lab values also tells you what type of mechanism it may be, and it may be related to the fact that it is the adenovirus vector vaccine that may be causally linked. And mind you, I'm not saying they're causally linked. They're looking into whether it indeed is the case.
Thank you for that. Now, there's been some question, and you kind of touched on it a little bit, but there was talk in the last 24 hours about some linkage, in particular with women, the linkage between perhaps the blood clots, the vaccine, and birth control. Clearly, there's not been a definitive answer in any of that. But what is your advice if a woman is on birth control, had the J&J dose? Is there any follow-up conversation about those potential linkages? And again, we're not saying there's a linkage. We're just trying to rule out, or at least speak to some of the area of concern that's come up in the last 24 hours.
Okay. A couple of points that I will make.
And you can correct my language, please.
Yeah, any question that individuals, young females who have received the vaccine and may be on oral contraceptives, they should really have a discussion with their primary physician on risk and what to do. I will tell you that individuals typically who presented with this clinical presentation presented within 3 weeks of receiving the vaccine. So individuals we haven't seen with this presentation beyond that date. So if people have received the Janssen vaccine in the past, meaning more than 3-4 weeks ago, they should. I think at this point the data suggests that they could probably put their minds at rest. The other thing to consider, as you mentioned, oral birth control pills, is that without even considering receiving the vaccine, individuals who take oral birth control pills are at slightly higher risk. Initially, when they came out and the level of estrogens were higher, the risk were higher. And so how they interplay, right now we have nothing to suggest that indeed those individuals who had these clinical presentations of blood clots were also on birth control pills, and we do not believe that there is a causal link, but all that is being studied as we speak.
Okay, so we did get a question from someone asking if they've gotten the J&J dose and there's a need for a booster shot. Let's say as follow-up, which by the way we've talked about several weeks in a row. The likelihood is with COVID-19, the vaccines would become annualized in some way. Potentially, like the flu shot, like you would just ordinarily go through that process, choose whether or not you want to have that vaccine, but it would be added to the regimen, if you will, of vaccines offered to people annually. But we don't know enough about what the FDA is evaluating. We don't know if there is any area of concern, and so there really couldn't be any projection, could there, Dr. V, about any future use of a booster shot or a follow-up J&J vaccine?
It's not out of the realm of possibility. In fact, it's my personal opinion that I believe that we will need boosters because of the way that coronaviruses and coronavirus-related immunity works. But we still don't know. And just like flu shots, there are multiple flu shots, multiple platforms for delivering the flu shot. It wouldn't be out of the realm of possibility, but it's way too early to make a guess.
And no one at this point should be concerned about taking a booster shot a year from now as it relates to the FDA pause currently, because the FDA is doing the analysis and will then advise if there's any precautionary step that should be taken for those who still may want and still will want to get the vaccine. Should it be reintroduced and we can get back to providing it, or should there be a booster shot necessary? The FDA, in its evaluation, would determine if there's any causality or any linkage, and then whether or not someone should take some precautionary step. Does that sound right to you?
Agreed. I think that's a reasonable statement. What I will tell you, what the takeaway point for people to understand is the fact that for the FDA and the CDC to take this route, especially given the extreme uncommon occurrence, like 1 in a million occurrence with the doses given, they are committed to safety And so in the future, when vaccines and potentially boosters are made available, the availability and the authorization and the licensing of these products will be guided by data and science, and people should have a level of comfort and confidence that it's being done appropriately.
And in fairness to the FDA and the CDC, there's really no easy answer here, is there? If had they taken no action, of course, there could be the risk of some health. There could be some health risk, and then they'd be criticized for not acting at all, even if it was even if it remains of a small number. And by taking the action they took, of course, they are going to be criticized for perhaps overreacting. So there isn't an easy answer here, but it does suggest, as you've said, Dr. V, that they're taking they take these things seriously. They saw the potential for some connection, and they're evaluating it. And then when they're done with that evaluation, they'll provide both the public and providers like us guidance moving forward.
That's absolutely correct. And what people have to understand is, by making this known and bringing this to the attention of the medical community as well as to the population, what we are doing is any cases or presentation of this clinical complex that probably would not be identified, there's a spotlight being thrown. And so people are less likely, or the medical community are less likely, to miss these events and link them to a potential vaccine administration. So that's another reason. We want to make sure that, is it only 6 cases, or is there, like, underneath the surface, are there many more cases that were not reported because people just did not make that association or the linkage. So these are things that they're all considering.
Well, for transparency purposes, Dr. V, you know that my wife and I both received the Johnson & Johnson vaccine over 2 weeks ago now. So technically, right, we've completed our vaccine regimen, and having waited those 2 weeks, we're deemed vaccinated. But of course, when we woke up yesterday morning, in particular, I would say my wife, because the initial reaction and the commentary from professionals yesterday morning was, to be somewhat concerned. If you were not concerned, you should be aware that these cases of this particular blood clotting may have been affiliated with women between the ages of 18 and 40. My wife falls in that category, so there was a moment of pause. But like everyone else, we're waiting for the FDA to give guidance. We've not experienced any particular reaction, so we don't have a heightened alarm. But in fairness, we too want to hear what the FDA has to say, and we'll allow them to go through that process. And hopefully, as was said, I think late yesterday, early this morning, they expect this to be perhaps just a couple days before they can give some guidance.
That's absolutely correct.
Thank you. So let's talk a little bit about, Dr. V, I'll get back to you in a moment. We have a couple other questions regarding some specifics with vaccination. But let's talk a little bit for a moment on vaccine distribution this week. As I said, Dutchess County following the FDA and CDC guidance and instruction by the New York State Department of Health early yesterday initiated a pause in the distribution of Johnson & Johnson vaccines here in Dutchess County. So that will obviously reduce the total number of vaccinations conducted within the county this week. I do want to say this, however, the state of New York has been very responsive to our request to increase vaccine dose availability in the county. We actually have seen a significant increase in the Johnson & Johnson doses. So again, we're hopeful that the FDA will allow us to, not allow us, that all is safe, people are of no greater risk, and that the vaccine can be reintroduced and we can get back to making use of it. But I will tell you that we've seen an increase in our availability of the Johnson & Johnson doses, which really we've made good use of. We're using the single dose as a way to get into neighborhoods and communities, smaller numbers, more strategic, where we can really make a substantial difference. And I think for those of you who have taken part in one of our pop-up clinics or permanent fixed clinics, I think you'd agree that the quality is there. We've got a great team at the Department of Behavioral and Community Health, Department of Emergency Response, our IT department, and others, along with our Medical Reserve Corps volunteers, have really done a tremendous amount of work. However, again, we're adhering to the guidance. We're pausing and had yesterday morning paused the Johnson & Johnson distribution, and we'll await FDA guidance. This week, then, Dutchess County, throughout Dutchess County, we have received 3,600 doses to be administered. Local pharmacies and hospitals throughout the county are receiving 1,400 doses. These are principally Moderna shots, if I'm correct. And then Dutchess County's health department is receiving and did receive 2,200 Moderna doses. Now, I will say it is a slight, now this is where things get complicated. It is a slight reduction in the Moderna doses from last week, but that's understandable because if you recall, several weeks ago, I think it was 2 weeks ago, maybe a little bit less, Johnson & Johnson had made known that a facility in Baltimore had a spoilage of Johnson & Johnson doses, so they were not being distributed. I think, if I'm correct, it's something in the neighborhood of 15 million doses, I think, were spoiled and couldn't be used, which meant New York State, all the states, saw a substantial reduction for week 18, this week, in Johnson & Johnson doses. That said, the state did actually provide us an increase in Johnson & Johnson doses, but late last week, which would have allowed us to use them. They're on pause now, but would have allowed us to use them this week. We all saw a slight reduction, every county, in the Moderna shots because not having access to the Johnson & Johnson dose, they wanted to more equitably distribute the Moderna shots. So again, it's a long answer, but I wanted you to understand it. 2,200 Moderna doses administered. That'll be 1,500 at our fixed pods this week. That's the JCPenney's location and the CVS in the town of Dover. Now, working with our partners, we'll conduct 700 additional doses to homebound patients, those with intellectual and developmental disabilities, and Sun River Healthcare is partnering with us to provide for a clinic at the Family Partnership Center in the city of Poughkeepsie. So those are all underway this week. Nearly 4,300 total first and second doses will be administered by the health department and our partners this week. So still a very robust number of doses underway. But the nearly 1,000 Johnson & Johnson doses we would have administered this week are on pause, which does mean that we did, and those of you who had scheduled appointments would have received notice from us. We did have to, in essence, pause those appointments. We did offer everyone who we could communicate with an opportunity to sign up for a Moderna shot. Some took it, some wanted to wait. And when we are able to restart making use of the Johnson & Johnson dose, which we hope we can, we're awaiting the FDA guidance. But should we be able to resume using the Johnson & Johnson dose, those people who had appointments will be given their appointments, and we'll get back to scheduling those pop-up clinics. Additionally, this week we partnered with Marist College. In fact, we've been partnering with all of our area colleges, but this week we partnered specifically with Marist College to vaccinate students. This is a collaboration between Dutchess County's Health Department, Westchester Medical Center, and Marist College itself, where we have initiated a schedule to vaccinate students on college campuses. Now, that partnership is going to continue with our other colleges, Bard College, Culinary Institute of America, Dutchess Community College, Vassar, and Marist. All we're partnering with to get individuals on campus, students on campus, vaccinated. Now, additionally, we're expanding a number of partnership opportunities. In fact, the Poughkeepsie City School District is working with an independent provider that we've coordinated to host a pop-up clinic at their high school site. This is specifically for high school students and City of Poughkeepsie residents 16 years of age and older. That's this Saturday, April the 17th at the Poughkeepsie High School. All of those with a City of Poughkeepsie address who signed up on our vaccine wait list are getting notice of these appointment opportunities. So again, this Saturday, in partnership with an independent provider, we've coordinated with the Poughkeepsie City School District to provide, these would be Pfizer doses available to 16-year-olds students in the City of Poughkeepsie School District and City of Poughkeepsie residents who signed up on the county's wait list. And you will be notified of the appointment availability as that becomes open to you. Now, additionally, we're hosting our pop-up clinics. We were scheduled to have a clinic at the Arlington School District. This would have been in the town of LaGrange. Today, in fact, we would have also been holding a smaller clinic at the American Legion in the village of Millerton in the town of Northeast Dutchess. And again, those were canceled as we await guidance from the FDA. Now, as I said, everyone who's scheduled with us to attend one of those clinics, they were all offered a Moderna appointment for a Moderna shot at one of our fixed pods. And once we get FDA guidance, we hope to be able to resume those pop-up clinics. Now, additionally, we've seen great success with those pop-up clinics, very productive. We've been to Beacon, East Fishkill, Hyde Park, City of Poughkeepsie, Pine Plains. It's very difficult to do the double doses at those locations because, again, we're sort of mobilizing and for a short period of time, but we hope to be able to resume those single-dose location pop-ups as we move forward. And again, if you want more information about the county's wait list, you can visit dutchessny.gov/vaccine information form. We've been going through this list pretty steadily, and in fact, as we go through it, we're finding more and more people have either opted out of the list or have received their vaccines or are scheduled to receive their vaccines. So we are going through that list pretty aggressively. Now, I will say, if you signed up on that list early in the year, if you signed up in January timeframe, we did send you an email saying, you've been on the list for a long time. If you still need to, if you still have a vaccine need, please let us know, and we're trying to connect you with appointment opportunities. We'll continue to do that. So the other is, as we find more and more appointments becoming available and fewer residents on the wait list needing to go through our wait list, there will be appointment opportunities that we just simply advertise. So I do encourage you to visit the county's website. You visit dutchessny.gov, you go to the vaccine update form, and you'll see the list. There's a list of all of those potential available sites. There are locations, the health department and others, that have appointments that become available on any given day. So if you're looking for an appointment and you haven't found one yet, visit the county website. You might find one available because the links will be there. Now, the other is, as appointments become available, and we need to share that information, and we don't necessarily have people waiting to sign up, we may hit send on an email, or we may post it on the website, or even post it on social media and say sign up. When you click on that link, if it comes up that there's no longer appointments, that isn't a failure of anyone. It meant that we filled them up, that they were available for a period of time, and people took them. And when they get filled, we administer the vaccine. So we have yet to waste a vaccine. We've yet not to fill an appointment. And as I said, Dutchess County's health department has administered nearly 42,000 doses itself. So we're getting through those lists as best we can. Now, remember, if you don't have internet access and you need to reach out to us, you can contact 845-486, if you're a senior citizen, 845, no, let's do this again. If you don't have internet access and you like to get on the wait list or get an appointment, you can call or visit any of Dutchess County's libraries, any library in Dutchess County, thanks to Tom Lawrence, the Mid-Hudson Library Association, and all the library directors across the county. They'll help you sign up. If you're a senior citizen and you want direct assistance from the Office for the Aging, you can call 845-486-2555, and one of our Office for the Aging staff or volunteers will be happy to help you. You can also call the COVID hotline at 845-486-3555, 845-486-3555. Press 1. When you press 1, it'll tell you the availability that week and vaccine updates that week. And then press 2, and you'll be shuttled off to a volunteer or staff person who will help get your information onto our waiting list. And let me say this, if you are 60 years of age or older and still need to receive the COVID-19 vaccine, just call the Office for the Aging. So again, if you're 60 years of age or older and still need access to a vaccine, whether you're on our wait list or not, whether your son or daughter told you to or not, whether you think someone else called or not, call the Office for the Aging at 486-2555, and we will get you an appointment. So if you're 60 years of age or older, 845-486-2555. If you've not already received your vaccine, we're going to get you in. It'll be a streamlined process. We'll get you scheduled and take care of that with you. Additionally, if you need a ride to one of our locations, remember the county transit system is providing a free bus ride to our locations. You can take advantage of either the county's fixed bus routes to the JCPenney or Dover location, or make use of the county's paratransit. You just have to show your appointment confirmation, and they'll let you ride for free to and from the clinic only. So take advantage of that if you need it. Good information for you. Want to mention that we are still conducting our public transit survey, trying to enhance the way in which we provide public transportation countywide. That's ongoing through the 16th of this month. Visit dutchessny.gov/public transit. And if you participate in that survey, you are entered to win one of 4 25 Visa cards. Exciting stuff. $25 Visa cards available to you. Want to mention next Wednesday morning, I'll be presenting to the Dutchess County Regional Chamber of Commerce their monthly breakfast. That's April 21st at 7:30 a.m. This is a hybrid event, but if you're interested in participating, visit www.dcrcoc.org. dcrcoc.org. Happy to have you join us for that presentation. We'll be talking a little bit about our work to provide assistance to small businesses as we move forward. Also, April 24th and 25th, Earth Awakening Weekend in celebration of Earth Day. The Dutchess County Parks Division is celebrating all weekend long. The 24th and 25th of April at Bowden Park, in Wappinger, you can visit us in partnership with Cornell Cooperative Extension of Dutchess County, the Public Library District, and River Winds Gallery. And for more information, you can visit dutchessny.gov/parks or online at on Facebook at Dutchess County Parks. Dutchess County Parks. Are they on Instagram too, or just Facebook? Anyway. We're going to go back to Dr. V for a couple questions that did come up. Dr. V, do people who are vaccinated but not 2 weeks out from that vaccine, from their second shot, do they have to quarantine if they're exposed to a positive case? Again, I'll say first, very technically, you must be basically within 6 feet of one another for a prolonged period of time. That identifies as a contact. But if they're not 2 weeks out from the conclusion of their vaccine, but come into contact with a positive case, do they still have to quarantine?
That's a good question. And the current guidance is if they are not considered fully vaccinated, meaning either they've received 1 dose of the Janssen or two weeks post 2 doses of the Pfizer or Moderna vaccine, yes, they do have to quarantine.
Okay. Yes, so that still is the rule. I am completed today, in fact. Today is day 14 for me from the Johnson & Johnson dose we received 2 weeks ago. Is Dutchess County seeing any positive cases among those who are vaccinated? Do we have? The short answer is I am aware of individuals that have not completed their double dose, having seen a positive case, right? They may have gotten their first dose, but not their second, and they tested positive. Are we seeing any number of individuals that we can point to, Dr. V, that have completed their vaccination regimen or series and still have tested positive that we know of?
So it's anecdotal, but yes, people have tested positive after vaccination. That does not mean it's clinically relevant, and I will explain. If someone is fully vaccinated, the assumption is that they have neutralizing and protective antibodies. And so they should not be a symptomatic case or land them in the hospital or worse. What people may have is if they are tested on a regular basis because they attend a specific school or is part of their job, they can become colonized, meaning there's the presence of the organism in their oral pharynx, and they are swabbed, they test positive, but they're not sick. So this scenario can play out, and it's biologically possible, and we see it all the time in the medical system. If I went around swab people, their fingers or their throat, we could find pathogens that typically cause disease, but they're perfectly fine. And so the short answer is yes, they could test positive, but in Dutchess County, we have not had a case of someone who was fully vaccinated and subsequently became sick with COVID.
Okay.
That I haven't heard of yet.
And that's a distinction. Testing positive means the virus could be rested in, where they're doing the swab.
It's colonized.
It's colonizing? That's great news.
Yeah.
Do they take up tents and?
No, that's a medical term.
Yes. But that's a good distinction. They could test positive, but they're likely not sick, and we don't yet have a case of someone who's sick having been vaccinated that we're aware of.
Correct.
Now that's possible because vaccines are not perfect.
That is absolutely correct.
Okay. So we did get a question about the VAERS data. Is that data researched on all the various vaccines? In other words, and the answer is yes, but you talked about this. Any adverse reaction or any adverse effect that anybody faces or feels ought to be reported by a healthcare provider, and then this data is evaluated and studied regardless of which vaccine or which drug you might be taking or prescribed. Is that correct?
That is absolutely correct. Meaning, if I get a flu shot and I have a severe reaction or end up in the hospital, a VAERS report would be done by my provider or my caretaker. And so, any vaccine or biologic that causes a reaction or an adverse event, a VAERS report would be done, even years after it's been in use in the population.
So it's constantly ongoing. I get my polio shot. I have some sort of reaction. A VAERS report is made if I report it to my physician.
Correct.
Okay. And so, but just because a VAERS report is made doesn't necessarily mean there's an affiliation or some connection. However, it's the tool that the Department of Housing, Health and Human Services, FDA, and others use to monitor and then make decisions based on that data. Is that correct?
Yeah, this is one of the critical ways data is collected post-authorization or post-licensing, because remember, the clinical trials looked at these vaccines in 30,000 sample size, 40,000, 50,000, but now post-marketing or post-authorization, millions of people are being vaccinated. And so there may be clinical events that have a very low occurrence rate, and we pick these up through these type of reports.
So we did get a question that came in earlier today. I'd like to answer it now. I think it's probably worth discussing to some degree, but I do want to hold Dr. V on for a moment. It's a result to an incident that was an off-campus party associated with Marist College students. And if you saw some video, I think they flipped a car. They flipped a vehicle at this particular off-campus party. First, I want to say to students who come to Dutchess County, no matter where you live, you're ambassadors and representatives of your family, of yourselves, and the college institution. And just as Marist College, Vassar, the Culinary, Dutchess Community College, and Bard want the best ambassadors and have asked you to be the best representatives you can be, we also know that when these incidents happen, they need to be responded to. And so I do want to commend Marist. They do take these things seriously. They respond in the way that they deem appropriate. It's their institution. There are certain responses that are appropriate that they take with their students, as does every college campus. This particular incident included a response from law enforcement, and when law enforcement responds, there's an entire process there. the town of Poughkeepsie Police Department, presumably in this case, but it could be City of Poughkeepsie, it could be Hyde Park. These police agencies take these kinds of things seriously. We understand that we are living in a very challenging time. We understand that a lot of people want to blow off steam. That is not the way to do it. We ask you to be safe. Not only with physical action like that, we don't want you doing that sort of thing, but we want you to be safe as it relates to your public health. Now, additionally, I think it's important to note that while we've had cases at every college campus, we've had cases at the Marist campus. Dr. V, the positivity rate at our college campuses, including Marist, have been consistently lower than the community positivity rate or thereabout. Do you have any insight on that?
So I will tell you that, again, since the very beginning, we've coordinated with the colleges, and the colleges have done a wonderful job putting in policies and procedures and mitigation steps and surveillance testing of their population, and they have done a wonderful job in controlling COVID. Periodically, we've seen clusters of cases. We have not seen spillover into the general community. Most recently, we've seen an uptick of cases in Marist that we're following, and we have been in close contact with Marist in terms of some of the steps that should be taken, including vaccination, and so we're following that up.
Thank you for that. I have 4 children. I am their father, and I speak to them the way a father would want to speak to their children. College students are not my kids. I am not their parent. And so my expectation is this, to simply send the message that whether it is in the beginning days of your life as a college student or in the weaning hours, just do your best to be good representatives of your family, of yourselves, and of the college institution. We have all been through a lot these last 14 months. We don't need frivolous actions to respond to. We don't need law enforcement redirected from important work because someone wanted to act irresponsibly or thought they were simply blowing off steam or having fun when you very well could have endangered others. And so I just call on all of us, including our students, to be the very best they can be. But I also want to say very clearly that our college campuses take these things seriously. And when and if there's a need for law enforcement involvement, which was the case in this scenario, law enforcement takes it seriously as well. And I have the utmost faith in the town of Poughkeepsie, the city of Poughkeepsie, the town of Hyde Park, and all of our local police department agencies to take this responsibly and to be clear that inappropriate actions like this are just not something that we can accept. So be safer, be better, and come on. We're in the last few days, the last few months of a very long school year. Let's be our best in these last few days and weeks. So thank you for that. Wanted to importantly respond. That's a good question. Dr. V, should vaccinated people be going for antibody testing in the coming months? What's the relationship between that?
Currently, there is no utility in doing that. There's ongoing studies that are being done by the pharmaceutical companies to see how robust and long-lasting the antibodies remain in our bodies. And we have early indication that the Pfizer and probably the Moderna also last at least 6 months. And so currently there is no guidance in terms of the utility of using antibodies because there hasn't been any standardization or studies that says this level is associated with protection, this level is not. And so there is no utility in doing that at this point.
Thank you, Dr. V. And so as we wind down today's town hall, we'll be back again next Wednesday. Let me also thank you, Anil. You have been a great steward at the health department, certainly for your time here, but also most importantly, these last 14 months, you've been a great sport at these town hall meetings, allowing me to pretend to be a doctor on TV. I try my best to be as informed as I can. But obviously, folks like to hear from you, especially when you wear your white coat. I didn't notice you wearing it today, but when you wear your white coat, people They take you more seriously than they do me. But to folks watching, Dr. Anil Wythian's infectious disease doctor himself, Commissioner of Health, we're very grateful to you, Anil, both today and these last 14 months. And while we're at it, again, our thanks to our American Sign Language interpreters who have been here from day one. And when I say day one, I mean my day one. From the day I became county executive, we've made use of the sign language interpreters as a responsible way of making sure everyone of every ability is communicated with. I've picked up a few words. I feel like they've called me a few names over these 14 months, or at least a little bit. I will tell you, to the both of you, my 4-year-old son Eli has learned to sign poop. 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 Just wanted to be sure. This he's. Is that right? He was very proud of himself. Listen, I'm sorry to do it. Every little boy, maybe even little girls, when they're that young, I mean, every fifth word is that. And he learned how to say poop. I got it right? Poop. There you go. And on that note, join us again next week. We're at 3 p.m. on the 20th. Eli's going to do a town hall meeting one of these days. Wednesday, April 21st, we'll be at 3 o'clock again on Facebook Live. And on the 28th at 5:30 p.m., we'll do our telephone town hall. In the meantime, thanks, be safe, stay healthy, and be kind to each other.